Okay, so it's a couple minutes past the hour. There's enough business to attest to at the beginning that I think I'm okay starting. I don't know if we're going to use all of our time today, but hopefully at the end we'll have some time to ask questions. Um, and welcome again. So my name is Sarah DeSilvi. I have the honor of being the Director of Clinical Informatics for the Gravity Project. I'm here with other members of the Gravity team, including members of the Terminology team, Linda Hyde, Asha Manuel, Katja Shell, Sarah Bahal, and then we have colleagues from the technical team as well. Our technical director, Dan Freeman, is on the call. I'm trying to see if any other of the technical folks are on the call. Um, uh,
Hi, Sarah, I'm here.
oh, who was that? Is that?
Sorry, that's Elena.
Oh, Elena, hi. Hello.
Hi.
Elena is our amazing co-chair of our technical advisory committee. All right, over next slide, please. I'll go through the agenda and then we'll get going. So a quick little welcome. This is what we're doing now. I'm expected to do kind of the standard level setting slide. So I'm going to do that on this slide in a couple of minutes. We're going to start with just a basic overview of VSAC. Then we're going to go into value set structure. Neither of these sections will take 10 minutes. They will be very brief. And that helps me segue into the expectations and objectives for today. Is anyone else hearing a constant beeping noise? That is the entry, the noise when people enter. That's what I'm hearing. There's a lot of beeping.
Same here.
Yeah.
It's normal.
Yeah, that's the normal noise. Oh, hi, Mark. Was that Mark? Mark's our policy.
That was Mark.
Hi, Mark. And then we have, can we put the slides back up? I think I lost the slide. I can't see the slides anymore. Oh, and here's Corey Smith from our technical team. Yeah, so once people stop, once the attendees settle, the beeping should stop. But you are correct and you're not alone. Sometimes that happens and sometimes it does not. It is happening today. All right. So Mark, 75 participants, correct. So the intent of today, I'm going to just give a little grounding, is to really speak to how individuals might use the gravity value sets and how some of our friends are going to use them in their work. We are not going to do a huge value set education that's beyond the scope of gravity and beyond the scope of this hour. So it's really to highlight how the gravity value sets might be used by our friends in implementation, and specifically in some of the products and utilities of the Fire ID and US Core. So we have a couple, this is the three sections we have of the talk today. Again, general overview, what is VSAC, how to get access to the value sets, and how the gravity value sets are structured. That's where we'll start, and I'm going to lead that with my the amazing experts in value sets and on the team who are not myself. That would be Linda Hyde and Katja Shell. And then we're going to briefly have some presentations from our friends. This is one of those instances where the best people to speak to some of the things that you can do with the value sets are the people who are doing that work in the field. So we have the honor, I'm very grateful that we have our colleagues at NCQA who are going to briefly talk about value sets and their work. And then we also have our longtime colleague, Ruth Wada from Cerner, who's going to talk about how she uses the value sets in her work as well. And that is much better representation of how to use these than I could ever give, which is a little bit farther away from implementation. And then we will go switch and be closing with an in-depth look about how the value sets integrate with the IG, led by Dan, the technical director. As per usual, if you have questions along the way, just pipe in. This is a consensus project and we do try to integrate. The best way to ask questions is by dropping them in the chat to everyone, and then we'll try to read them out loud. And we do try to make sure that all thoughts are integrated as we go. Again, we'll try to have some time for questions at the end. There might not be, we have many different experts on the line who might be able to answer them. And an important note is that this call will be recorded, as all of our gravity calls are recorded for posterity. So if you weren't able to attend today, you'll find it on the Confluence with all of the rest of our work. And thank you. Okay, so any questions so far before we kick in? All right, so we're going to briefly go into VSAC to start. Next slide, please. Thank you, Denise. All right, so this is the grounding of our model for gravity. This is the infinity wheel you've seen often over the course of our work, right? So on the left-hand side, you have the work of terminology, the work that I have the honor of leading, which is collating necessary terms to address each of the social domains in turn. You can see the processes we know and do together, data set identification, and then we analyze gaps to make sure that any gaps are built into code. That's part of that third step, new code submissions. And then that final step that we completed just in time for the November 15th balloting for US Core was the publication in the National Library of Medicine VSAC Value Set Authority Center. So you'll see over the course of this presentation how those coded value sets are kind of the glue that binds the technical team and the terminology team. They'll be most clearly represented in Dan's talk as he goes forward. Dan, any comments before we kick off, or did I do a sufficient job leading us into this work today?
That was lovely. I think we're ready to rock. Thank you.
All right. Thank you. That sounds great. And then because we recognize the capacity for implementation goes beyond just the work of the IG, this is why we have our friends to talk about some of the other uses of those value sets. We're very grateful for that. Next slide, please. All right, just a general VSAC overview. Again, kind of it's like the 101, and then understanding that there are many different ways to learn about VSAC directly from the National Library of Medicine. This is just to help us understand the basics. Next slide, please. So directly from VSAC, the values on value sets are lists of specific values, terms and their codes that define clinical concepts derived from standard vocabularies to support effective health information exchange. This is directly from the VSAC website on the National Library of Medicine. Value sets are dynamic, they're stewarded, and they're curated, right? They are not static. And so you need someone to take responsibility for the value set creation and the ongoing maintenance. For perpetuity, we the Gravity Project are the stewards of the value sets we're creating. And this is a very wise choice. We were basically asked to do this by our friends at the Office of the National Coordinator. It makes a lot of sense because the approaches, the integration with policy, the attention to new terminology, and the integration to our consensus evidence-based process means that we can try to do this and do this right, not just now, but over time. In order to do this work, you'll see in our future timelines, we are building in time to ensure that we have within our project plans to ensure we have time to pause and curate things, not just within build, but within the value sets themselves. In general, value sets form a frame of reference. You'll see in a bit how they're the bounds of the IG. Specifically, Dan has a little example here, what terms are allowed for condition.code, right? He'll go into that in a bit. But you'll see some of those bullets that these slides were originally presented at the Technical Advisory Committee. Some of the uses for value sets beyond just the IG, or in addition to some of the use cases we imagine within the IG, because we do talk about outcomes and aggregation within the IG in some of our future work. They can help you answer questions, such as what terms serve as the denominator or a housing instability registry? If I'm trying to build an intelligent grouping, what are the boundaries and codes that would be contained in that? Or what terms constitute an intervention for an elder abuse clinical quality measure? So these kinds of specific questions, there's no need to go searching because they are grouped intelligently within the Value Set Authority Center for use, again, in implementation across the ecosystem. Next slide, please. An important thing to note is that although the value sets within VSAC are free and publicly available, you do need a login in order to access them. It is really easy. It's much easier, actually, I'm going to say, than it ever was to get a NIH, National Library Set of Medicine Value Set Authority Center, UMLS Terminology Services account. It is super easy. We can actually put the login, the link in the chat at the end, because you're allowed to use any of the identity providers. Like I logged in to redo mine. I went in with my Google account, or you can set one up independently with email. There is literally maybe just a few hours sometimes spacing between the requesting of an account and the authorization of account, and then you're good to go. And the great thing is this account allows you to access the full suite, if you're a terminology nerd, the full suite of resources within UMLS. So there's not just value sets there, there's a lot there. We do much of our work in the US that we're doing our code building happens within the National Library of Medicine. So there's a lot there to explore once you have a license beyond just having VSAC access. Any questions about that? Great, okay. Now on to the next. All right, so now we're going to quickly go into reminding everybody about the gravity value set structure that we took, and this should look familiar because we've been using this structure from the beginning in how we talk about our work. Next slide, please. So the new part, which some people may be aware of, is that beyond just domain organization, the value sets that we have within Gravity are organized by activities in line with US CDI v2 and US Core. So that means you know and you see, many of you see within our terminology work, for those of you who are terminology folks, and again, this is not new to the technical folks because this is the heart of the implementation guide, but we build within screening questions and answers, diagnoses, goals, and interventions. VSAC is not a great place for putting screening questions and answers because the logic of the question and answer unit is very difficult to convey. So within VSAC right now, there are both domain level organization by diagnoses, goals, and interventions, but also broad organization by social determinants of health diagnoses, social determinants of health goals, and social determinants of health interventions. Within those broad organizations, social determinants of health diagnoses, goals, and interventions, there's further organization, if you can imagine like an envelope, right? So there's a broad envelope of social determinants of health diagnoses, and there's a smaller, within it, an envelope for food insecurity, diagnoses, goals, and interventions. Housing instability, diagnoses, goals, and interventions, etc. The reason why we did this is because we try to build our products in ways that can be used in many different ways and that are practical, right? So it allows us to use these terms within the implementation guide and US core support while allowing domain level value set use for activities such as quality measures or registries or anything you desire. Linda, I'm going to put you on the spot. I know you have to leave shortly. Anything else to say regarding this slide? Linda Hyde is the genius behind the value set build and really just an anchor and mentor for me in the terminology work across the board. Anything, did I miss anything, Linda?
No, you didn't. No, you covered it very well.
Good. Yes. Yes. If you all just knew how much I aim to make Linda proud every day, man, she's amazing. So thank you. That's good. And Linda and Katya Shell, along with our colleagues at the American Medical Association, Jim Shalaby and the team over there at the AMA, Monique Van Berkem, just very, very grateful for all of the work that went into the conceptualization and the build of these value sets. And then also just a specific nod to our friends at the ONC, Al Taylor, and then we worked very closely with Gay Dolan as well. So there was a lot of integration that went into building these value sets in this fashion. And we're just grateful, as always, for the many, many partners and friends we have in our work. I'm going to show you a little bit more specifically what that looks like over the next slide. Next slide, please. Devin has a question. I wonder, Devin, we've been actually talking about this question specifically within the Gravity Project internal messaging. This question was forwarded to us prior to the call. I don't know if Dan or anybody from the technical team has an answer to this as it stands. We were just going back and forth about it like all day yesterday. I don't know if anyone from the technical team is able to answer that as I keep on going with the presentation. That would be helpful. I'm going to keep on talking, and then if not, Devin, we'll loop back around. If you give us your email, we'll try to answer your question after the presentation. All right, so further organization. So if you log into the Value Set Authority Center, and no, you're great. But we do want to try to answer that question. And let's just say that you are allowed to refine by different filters, and you can refine by the coding steward. By the value set steward. And again, as we mentioned in the beginning, for the purposes of the Value Set Authority Center Gravity Project value sets, we are the steward. So the easiest way to find all the product that we've created in our value sets is to refine by steward, and you can find everything there, right? And what this allows you to do is what VSAC allows you to do is export spreadsheets that contain all of the relevant terminology. You can download humongous lists that contain all the diagnoses that we've addressed so far within our work, or you can filter it down to the different domains. You can even filter it further to the different subtypes of terminology within those domains, right? So you can see I've highlighted housing instability diagnoses, and then also highlighted ICD-10-CM and SNOMED-CT as an example of subtypes within our diagnoses build. And then you just export search results. You can see I have a huge green arrow here. So, and then you can download them directly to your computer. I do want to state just carefully that there's a lot to explore in here. So once you log in and get a license, there's I think about 20 pages, and you can see all the different types of organization across all the different work we've done. Yes, Gabe, we do need to post the URL to the system, and as soon as I'm not presenting, I will grab it because I have it in another screen, and I will drop it in the chat. I promise. Many thanks to you, Gabe, longtime friend. Okay, next slide, please. All right, so this is what the end product looks like. I chose to just download the food insecurity diagnoses, and this is what the eventual spreadsheet looks like when you get it onto your own system. And so far we've covered how to get access to the Value Set Authority Center through getting a UMLS account. And I will drop the link again. Oh, thank you. Thank you, friends. And we've also talked about how value sets can be used both within our implementation guide and US Core, and also through different implementation questions. And then we've looked at the structure of the value sets, which are organized broadly by social determinants of health and the activity of reference. So social determinants of health diagnoses, social determinants of health goals, social determinants of health interventions, and then all of the subdomains, which are food insecurity, housing instability, elder abuse, intimate partner violence, etc. Again, each with those different categories, and those categories should be very familiar for anyone who follows along the public calls, because that's the structure that's woven into all of our build. We are now going to briefly pivot. Timing is perfect. To have some friends talk about how they anticipate using the Gravity VSAC value sets. And we have a couple guests. We have Ruth Wada from Cerner. I'm going to go first to her. If we go next slide, please. And then our amazing friend, Fern McCree, or someone from VSAC. I don't know if it's specifically Fern. I'm just very grateful. Fern and I sent emails back and forth quite a bit. And then we're going to pass the mic off to our friends from NCQA. Again, this is just to talk specifically. Ruth has some slides, but really we wanted to hear directly from the voice of our friends some of those implementation uses that we know to be possible within the VSAC Gravity value sets. Ruth, are you ready? Is your mic working? I wonder if her audio is working. Maybe Fern, do you want to start and then we will transition to Ruth when we can hear her voice?
Absolutely. Can you hear me okay?
Yes, we can. Hi, Fern.
Hi, Sarah. Hi, everyone. It's a pleasure to speak with you all today. And as Sarah was saying, we've been chatting back and forth. So I was very excited to be invited to speak with you about our work at NCQA. So again, I'm representing the team at NCQA who's developing a new measure in which we're using the gravity value set. So this is very timely. And we've been working with and meeting with Sarah's team over the last couple months as we've been working. We're currently in the development phase and testing phase of the measure. So we just wanted to share where we are with it and how this is relates to our work. But again, this is just a big disclaimer. We're still in development phase, so some of what I'm sharing could be subject to change in the future. But I think it's still helpful to just hear about how this is all helping us move forward. So. I don't have any slides, but I'll just speak to the new measure. And first, I'll just give a background. So one, the measure is focusing on addressing unmet social needs. So it's actually called the Social Needs Screening and Intervention Measure. And so we're looking at 3 different domains of social needs. So food, transportation, and housing. And we've identified those based on just consensus from different experts and technical panels, as well as you all may know, those particular domains are pretty far along in terms of the standards and the terminology. And so our measure is focusing on screening and intervention for those 3 domains of social need. And if I hadn't mentioned it yet, it is a health plan level measure. And so we're going to be including it in our HEDIS health plan measure, quality measure set. And so the measure, just to give a description, it's looking at the percentage of members who receive at least one. I'm sorry, was there a question? So the percentage of members who received at least, were screened at least once for one of these, for each of these domains, so unmet foods, housing, and transportation, and if screened positive, received an intervention. And so there's going to be 2 rates where we're thinking now will be 2 rates, one for screening and one for intervention for each of the 3 different domains as it stands today. And then for the screening, we're including a broad range of different screening tools, starting with those identified by Gravity. And for the interventions, we're also using the interventions that were identified by the Gravity Project as well. And again, we're in testing, so we're exploring all of the different tools, but that's where we're starting right now in our measure specification. And we're looking across all different different product lines and across different ages in terms of the target population. So now let's get into the value set. So one I'll mention first, this measure is actually going to be using data sources, electronic clinical data sources. So not just administrative data, which is really key for this measure topic because we know a lot of this information is not going to be found in claims. It's where health plans readily have access to their claims data, but when we're talking about the use of specific tools, the use of specific instruments and results for those instruments, that's not found in administrative claims data for the most part. And so we are using a standard, a reporting standard that allows the use of EHR data, case management data outside of the administrative report, these administrative data sources, in addition to admin data sources. And so this really gets us to being able to look at more patient-specific care, right? Because we're not limited to the use of administrative claims. So we are actually using the value sets and the codes that Gravity has developed in this measure. And so, for the screening, because we need to know exactly which screening tool was used and what the result of that screening tool was used, or at least whether this patient member was screened positive, the LOINC codes that Gravity has identified, we are actually incorporating that in our measure. So for the whole host of different screening tools we've included. And we're thinking it'll probably be, these codes will be referenced directly into the measure. This is going to be a digital quality measure, so we're following a digital measure format. So we're using the FHIR CQL standard. And so we're actually incorporating those LOINC codes into the measure. And then for the intervention component, we're also using the codes and value sets identified for those 3 different domains as a way to meet the criteria, as the way to meet the criteria for having intervention or receiving an intervention after a positive screen. And so that really is the gist of it. Again, we're in testing, we're in development phase. I just wanted to point out, this is really a big deal. Being able to, in terms of NCQA strategy, we're really moving in this direction of more patient-specific measurement, centering our measures around data that's used for coordinating care, not just for measurement. And so this measure is really, and the work that Gravity is doing is really, really a catalyst to the future measure topics in this space, and particularly in equity. But I'll pause there just to see if there's any questions.
Any questions for the amazing Fern McCree and NCQA?
Oh, Sarah, stop.
Oh, we love you. We're good friends.
I just had a question because I didn't hear it, but what EMR are you guys using?
So what I've described is we're developing a health plan level measure, and so health plans will report this measure, and so they're actually going to be allowed to use different data sources. I don't know if this is going to be answering your question, but the measure is actually going to allow the use of administrative data, EHR, EMR data, case management data, and registry HIE data sources to be used for reporting. So they can pull, as long as this information is documented in a standardized way, of course, meeting the requirements of the measure and the guidelines for reporting for HEDIS. It can come from any of those 4 different data sources. So EMR, EHR would be an allowable sources for health plans to report if they have access to that information.
So Fern,
Thank you.
I have 2 questions for you. So we see a lot of timeline questions, but because some of us are quality measure nerds and some of us are not, can you just briefly describe the HEDIS measure program? I think we have time, just like a couple minutes, that might give context for some of the folks who are not accustomed to talking about the HEDIS measures.
Absolutely. No, certainly. I can certainly give an overview. So HEDIS, it stands for Healthcare Effectiveness Data and Information System. So it's a tool used by health plans to report quality measures. And so what we do, we test and develop these different quality metrics um, to be incorporated in this program. Some of our measures are used in different CMS programs or other programs as well. And so we have a cycle in which we develop our measures. And so our cycle is to test. When we have a measure concept, we test that measure concept, and then we take the measures through a vetting process in which we shared with different expert panels or technical panels to do, I guess, proof of concept, right? Or proof of concept, make sure the measure is valid and feasible. And then at which point we do go through a voting body that votes on the next steps for each of our measures. And then we post the measure for public comment. We post the measures for public comment. In this case, it'll be posted in February, possibly, if it moves to that phase. We have an open public comment where we get feedback from anyone really who implements the measure, or anyone who wants to provide comments on the measure. And then at which point, the next steps would be to continue to vet the measure and then include it in our next version of HEDIS, which is the measure portfolio. I don't know if that's helpful. um,
I think yeah, that sounds very helpful. And then we have a couple other questions here.
yep.
So, Dr. Gottlieb, our friend from Siren, it's so nice to have her swoop in. So she just has a question. I know we don't want to get too far down this pathway, but this is a really important one because there's a lot of like conversation regarding social determinants of health measures.
Yep.
And so Dr. Gottlieb has a question about how the NCQA process with your HEDIS measures relates to the CMS measures that have been proposed through the Physicians Foundation. And I don't know if you have an answer for that. That'd be helpful.
Yeah, I think I don't have a specific answer to that, but I can say that and my team who are the gurus of our our equity strategy are not on the line, but I can share that we have been working very closely with CMS and other key stakeholders to make sure our strategy is aligned with theirs. Our roadmap is aligned with CMS as well as other key stakeholders, not even just in our measurement work, but our other programs as well. So I can follow up with you just sort of specifically in terms of efforts there, in terms of that alignment. But I would certainly say they're working very closely to make sure that there is a streamlined effort there. I think one key thread in all of this work is trying to reduce the burden of measurement really across really at all different levels of reporting or all different levels of the healthcare system. And so one of that is making sure we have these alignments with our key stakeholders.
And then the one last question, and then we'll let you go because Dr. Rabner, what we're going to do is drop in. We always do an after meeting email, and we'll make sure that all the links that we posted are included in that after visit email or after meeting email, and the links to the work that NCQA is doing regarding these measures, we will include in that email so you can follow it at that time. And Charles Gabriel, yes, it's being recorded. And then one last question regarding the time frame.
Mhm.
So if you guys have a fairly rapid time frame for these measures. It's very ambitious, and so that'd be helpful for everyone before we let Fern go.
No, that's a great question. So it's not final just yet, but I can give some insight on our potential timeline for implementing the measure. So we're thinking it'll be measurement year 2023 or later. So that means the measure would be at earliest accounting for quality and care occurring in the calendar year 2023. So potentially releasing the measure later at the end of next year or mid next year is the idea. But that's really, again, I just want to say it's not confirmed just yet, but the earliest would be releasing a new measure next year that would be applicable for calendar year care provided in calendar year 2023. So it's a quick timeline, but again, it's still it's in the future to make sure we can support the transition for health plans and other stakeholders who are implementing the measure and making sure they have time to adjust to not just reporting the measure, but also the data infrastructure changes that we know are in progress to get us to where we want to be. So yeah, I hope that
Perfect.
answers your question. Yep.
It does. I think it's amazing. And so, So I hope it's okay. So again, what we'll do as part of our after visit email is send some of the links to what NCQA is doing, just to share it as it is, whatever is publicly available. And so I'll connect with you, Fern, just to make sure we have the right resources on that. And I just want to
Absolutely.
say thank you, Fern and NCQA, for your ongoing collaboration. You are stellar friends to have, and we really enjoy working with you. And any final thoughts before we let Fern go and switch to a different use case and regarding the value sets we've created within VSAC? So Matt, ooh, interesting. That's what I think that is a really the resource. The white paper is a really wonderful place to start. It's true. So Matt, I'm going to try to loop back around with that question just so we don't get too far afield. Just to pass the mic to Ruth, if it's okay, and then we can always try to connect after the fact. Ruth, is your mic
Yeah.
ready to be?
Sarah, can you hear me?
Yay! Okay,
Can you hear
wonderful.
me now?
Yes, we can. This is
Great. Okay.
wonderful. Okay,
Terrific.
I'm gonna let you lead. We did upload your slides there.
Super. Now you can go ahead and go to the next slide. And everyone, I work in the analytics space at Cerner in population health. So I used to work as a terminologist, but I've also been a health services researcher. So to me, where we've begun, my team, and trying to get this moved through Cerner is that it's all the same data. It's kind of the application, so that we've already started work in health disparities, application of different demographics to registry measures, and leveraging that within a care management program. And then we're moving towards health equity, where we'll actually apply analyses that help us to understand which of these determinant of health factors are more influential than others on the various different outcomes, whether it's a clinical, such as A1C or blood pressure control, looking more intermediate, like missed work days, even like health status, and then of course your costs and utilization. And then finally on the determinants of health, looking at what kind of exposure and risk are introduced, measuring those, quantifying those, and providing information back to the healthcare organization about what they mean, how they can leverage that. And these definitions, these are from Dr. Carney at the CDC, and it's really the first true operational definitions I've seen of these three closely related ideas. But Sarah, let's go to the next slide, because I only threw a couple in here. Oh, just go to the next one after that, because there's not quite enough time. This will give you a sense of some of the visualizations that we're working towards that answer questions at the point of care. They can be leveraged in the ambulatory setting, by clinic, up at the community level to drive planning efforts for the healthcare organizations. Where I'm spending most of my focus right now is understanding patterns. How do the determinants of health play together to actually drive intervention, so that do we see differences in A1C control by each one of the different individual determinants of health? But more importantly, when you look at a patient who has 2 health-related social needs versus 7 with 7 needs, you do see differences in utilization, in costs. And what my team is doing is trying to move upstream towards the clinical space to understand what's the influence of determinants of health variables on those short-term measures and even outputs in the care setting. So that's just a really quick overview. I've been waiting like 20 plus years for this data to arrive in the healthcare space. So to me, it's a terrifically exciting time for us to be working in this. And also, the work that the Gravity Project has done is so helpful in terms of filling those gaps, organizing the information so it makes it more consumable for the clients and for the healthcare organizations. So I'll turn it back to you, Sarah.
Yes, can I ask you one question, Ruth? Because I know you have an answer for this. You were talking, sorry, you were talking about how you've already downloaded the, you're already, just a quick story specifically on how you're integrating with the VSAC value sets already because you're like right in there. Would you mind just specifically speaking to that before I let you go?
Oh, that's consumed the last 2 weeks of my life, was actually downloading each one of these VSACs. So I have it in an Excel spreadsheet, but there's a tab for each one of the health-related social needs that are called out. And to make it easier, because I interact with clients in their planning in this space, so that I have it organized left to right, that I start with whatever tool they're using for screening, and then adding in like the Z code, SNOMED codes for diagnoses, health concern, then moving to goal, and then moving to interventions, service requests, etc. And because I used to work as a terminologist building registries, I attempted to organize and semi-curate the codes because, you know, the first step, of course, is the health concern, and that's what everybody wants. But for me, I see 7 to 10 years down the road, if we have enough data that just as we have bundles for hip and knee replacement, that we will see bundles so that patients with, say, if they've got food security, housing insecurity, transportation, how do those needs group and help us to understand what interventions, what's the sequence, timing, dosage of interventions that can be provided to improve outcomes. But we have to get our healthcare organizations to also move to using the interventions that are associated with the standard codes. It's still largely text-based, as you might guess. So that's really, I have found it terrifically helpful, and I can actually provide the information to clients to help their uptake a little bit, hasten that if we can.
Ruth, thank you so much. When I was thinking about who could address those 2 bullets that I mentioned in the beginning, which are, you know, about using the data, using VSAC value sets for quality measures, and using the value sets for grouping and aggregation and analysis, you were definitely the star for that second question, just knowing your work. So thank you so much. Any questions for Ruth before we switch to the value sets and its integration with the IG? I'm so grateful for our friends in the Gravity community for helping us really kind of give meaning for why the value sets are useful in many different settings.
Hey Ruth, this is Tom from the AMA. Just wondering if you had the same analysis completed for hypertension.
Ruth, did you hear Tom's question?
Yes, I'm sorry. Yeah, actually, we are working with the CURE project on this, and yeah, we have this prepped for work on hypertension as well.
We're working on a solution to automate self-measure blood pressure in these populations specifically and address the determinants of health in that solution. So love to talk to you more about that. If you wouldn't mind, and get your contact info, I'll get in touch.
It's the only thing I think about, Tom. So yeah, absolutely.
Ruth is a member of a longstanding member of our technical advisory committee. She has been on the TAC since its inception. I have the honor of knowing Ruth through the, which I'm sadly not able to attend, an amazing nursing social determinants of health data think tank group. So Tom, happy to connect to you and Ruth because Ruth is pretty amazing.
Fantastic. Thank you.
Any other questions before we go on to Dan? Again, thank you so much, Ruth. We love you. You know that. See you at the TAC in a few minutes. All right. Thank you. Passing the mic on to our technical director. Next slide, please. Next slide. Dan, it's all you.
Fantastic. Thanks, everyone. I'd like to talk about kind of two main things. The first is to sort of illustrate for you how this work from the terminology team and the definition of value sets connects to the implementation guide for FHIR-based exchange between systems. And then the second is to give you a little teaser if you haven't explored the API features of VSAC to interact with this representation of the value sets. So here I'm showing the FHIR implementation guide from the Gravity project. Major thanks to Bob Dieterle and Monique Van Berkum and Corey and all of the folks who have contributed to this. We are open for ballot on our second version, STU2, as we speak. The URL you can follow there. And as I described, this is the technical specs that help define standards-based exchange of SDOH data between different information systems. And on the next slide, I'll describe at a high level, the idea is that this one implementation guide defines an approach that works across all of those different domain-specific exchanges. So whether we're exchanging information about food insecurity or housing instability, the same structures for the information persist across all those different domains, but yet it's the terminology that varies. And the primary workflow described and supported by the implementation guide is for closed loop referrals, supported by screening and assessment and a variety of other activities. At the heart of it is a collection of some key clinical data profiles or resources, structures for holding information. And these are, in general, observation, condition, goal, service request, and procedure. And of course, there are a variety of other components too, but this is what I think of as sort of the heart of it. And wherever possible, we base our representation of these structural elements on the FHIR US core versions with some additional attributes or extensions or constraints added to support the workflows that we're talking about. On the next slide, I'll show you how the work of defining value sets has really stimulated and enabled a great collaboration with the team at HL7 working on FHIR US core to bring our approach and their approach into close alignment for representing the information in these core clinical structures. So in this table, I'm showing the condition, goal, service request, and procedure type structures and how what I think of as kind of the primary element. So when we're thinking about a condition, which might be a health concern or a item on a problem list or an encounter diagnosis, one of the key elements of that structure is the code, right? The code that represents the diagnosis. And in the implementation guide, our profile and the US core profile point to the same value set, a US core condition code value set, which is a collection of concepts from SNOMED CT and ICD-10 and so forth. And this really is sort of the upper bound, so sort of the largest set, but it also points to a SDOH specific value set, which is that grouping value set that Sarah described previously. And that contains all of the appropriate codes for representing conditions in the different SDOH domains. And both the Gravity IG and the US Core IG have language that says, if you're using or exchanging SDOH data, then the server should represent that data using concepts from these SDOH specific value sets. But having the structures point, in this way to kind of an upper bound value set as well as a more specific one helps align features that are used for servers and information systems used for things other than just SDOH data. I'll make two notes. One is that the value sets that Sarah described for representing screening assessments and risks and the sort of questionnaire-based stuff, as well as observations, is kind of a work in progress. We're still thinking through and developing the way to handle that best. And in addition, I'll just point out that US Core didn't yet have a value set for the goal structure until this current ballot cycle. And if and when that gets accepted, then we will update our kind of base value set pointing to the one that they have when that is published. Still then, having this narrowing down to the SDOH one as well. Okay, next slide. I'll give a sort of visual example to sort of help illustrate this. For one sort of common thing, I'll just use condition or sort of health concern as the example here. And so if we think about the value set binding for that element, condition.code, as I was describing on the previous slide, you can see how it can point to the one from US Core or the one from Gravity, the SDOH conditions, which is sort of the preferred value set when exchanging SDOH related data. And underneath that value set are the domain specific ones defined in VSAC. So that upper one is sort of the collector of all of those domain specific ones, which has a number of different advantages. Of course, being able to drill down into those specific ones, but also giving flexibility as additional domains are added. The information system can still be pointing to that upper level one and collect all the subsequent additions. And thus on the next slide, I'll just show two quick examples. So these value sets can be used in capturing and exchanging data. Here is a screenshot of our reference implementation software, which is sort of modeling or mimicking in EHR. And you can see here a rendering of a problem, an item on a problem list. And if you go to the next slide, you can see how sort of popping that item up is capturing and storing both the SNOMED and the ICD-10 codes that might represent the problems for this sample patient. All right, so on the next slide, I'll switch to my second topic, which is to give you a teaser for the great fun that you can have using APIs to interact with terminology content. Next slide. So this is fantastic because it enables a whole bunch of things that were a lot harder before we had standardized APIs for terminology services. You might be thinking that FHIR, you probably have heard of FHIR in the context of clinical data exchange, but you might not have actually thought about or appreciated that it has some neat features relative to working with terminologies. And that's what I'll give a teaser for today. So on the next slide, you can see the quick rundown of stuff you'll need. As Sarah mentioned, you got to have a login and a license. And if you were going to be using this API through like a client like Postman or in your application, you need a couple of other details that I've described there, including that you'll get an API key when you create your account with UMLS. And the base URI for the FHIR endpoint is listed in that bottom row there. So next slide shows you the way that a value set is structured in FHIR. Here's kind of a visual representation of that. You can see all the different attributes or data elements that it has. I've broken this into kind of two sections. This first one is about main metadata. There's a representation of things like, oh, the name of the value set, when it was last updated, its status, the description, and so forth. And then on the second section, the next slide, shows the kind of way in which the value set is defined. And that's kind of represented by this compose element. And inside of that compose element, there are ways just to describe which content, which either concepts or other value sets are included in this definition. And so that's sort of the way, the structure in which a value set is represented in FHIR, which is kind of neat. So on the next slide, I'll show an example API call where I'm just going to be calling that overall value set that the Gravity project has defined for SDOH conditions. In the upper portion of my screenshot, you can see some of that main metadata. And I'll mention, that VSAC uses these OIDs, these super long digits that are the identifiers. But then when you drop your gaze there to the lower portion and see the compose element, you'll see that the definition for this value set includes these other ones. And they're represented, of course, as that URI identifier, but those really represent the domain-specific value sets, the housing instability, food insecurity, et cetera. So that's the way this one is constructed. Okay, that's pretty neat. Let's take a look at one of those individual ones. So on the next slide, if you were to use a get command for one of those more specific value sets, you see that same type of structure, metadata, and so forth. But in this lower level one, you see the actual kind of enumeration of codes that it contains, the ICD-10 Z59 codes here. Okay, that's pretty cool. Next slide, we'll get to the API features. One is the expand operation, which says to the server, hey, take that definition and look inside those terminologies and find me the concepts that are included in that value set. And so this is an expand operation on that upper level one, which comes back with, you can see probably a little bit in the expansion element, that whole listing of codes starting with some snowman codes. So pretty cool. Next slide, I'll show one other sort of trick you can use on the expand operation, and that's to add a filter parameter, which passes, a text-based search on those display terms. So this is an example of that same query, but I said, hey, filter based on those that have elder in the display name, which you could imagine if you were actually using Fire to drive a user interface, you might be making those calls based on user input to a field. Awesome. All right, last operation from the API that I wanted to tease you with is the validate code operation. So on the next slide, I think I showed two examples, a successful and an unsuccessful one. And validate code is an operation that the API can perform to say, hey, if I pass you this code, tell me if it's actually in this value set or not. So here on the top screen, I am calling the API to find out if code 12242 from SNOMED is in this value set. And the response that the server provides is yes, it is here. And it tells you the result is true, and it shows you the string for that concept. Similarly, I could pass a different code. In the lower example, I've got M45.0 from ICD-10, and the server says, nope, that code is not in this value set. It gives you a structured response to that. So those are, sort of the high-level computable operations. Hopefully that gives you a sense, if you're a developer or are interested in sort of programmatically interacting with this content, what kinds of things might be possible. Of course, there's a lot more detail we could go in, but that should be good to whet your appetite. I'd be happy to take questions if there are any.
Dan, you always have a way of making things that seem really complicated very simple, and thank you for that. So first I want to honor, so Tom, you've had your hand up. Is this from the prior conversation, or is this new and we neglected to honor you?
Leftover, sorry, I'll take it down.
Oh, no, just want to make sure. And then we do have a question from Matt Bishop, and we are at time here. I thought we might end early, and no, this is a classic Sarah DeSilva problem where I always think we might be able to end early, but we never do. So Dan, do you have time to answer Matt's question and take us out?
I do, yes. So VSAC uses both Fire value set resource stuff for all of its value sets, as well as it has kind of its own proprietary API format as well. Both options are possible. And I think in the slides, there's a link that we can share to the documentation on that.
Okay, next slide. I think that's it, friends. Yes. Okay, so we've had a pretty wonderful hour hearing both about general value set structure within VSAC and Gravity, hearing from friends using the value sets for two different implementations that align with our use cases and our mission. Thanks, Fran. Thanks, Fern McCree from NCQA, and thanks, Ruth Wada from Cerner for coming today. Dan also went in depth not only on how it integrates with the IG, but about how to use APIs brilliantly to to use this information. The recording will be available on the Confluence, and we promise to follow up with an email that contains some of the questions that remain unanswered at this time. Whew. Yet another gravity dense hour. Any other final thoughts? We are so grateful for the general community. Thank you so much for your involvement. You can always find this recording on the Confluence, and we look forward to seeing you at a future Gravity call.
Thank you. Bye.
Thanks, everyone. Bye.